Today we're gonna start learning about anxiety and anxiety disorders, and understanding anger from the inside out. First, we think about anxiety and anxiety disorder. You or someone you know is dealing with anxiety. So, if this is the case, it's important that you know you are not alone. Problem of anxiety are such a common experience of people. The research into anxiety disorders has developed exponentially over the past 3 decades. However, given how much we've heard about anxiety disorders, what triggers them, and how to handle them effectively, people are still dealing with anxiety symptoms. For example, a poll of nearly 10,000 adults across the United States show that anxiety disorders are the most prevalent condition in mental health, with the exception of substance-related disorders. In fact, at some point in their lives, almost 1/3 of people surveyed have experienced at least one anxiety disorder. And why are there common anxiety disorders in our society? One single reason that determines why so many people struggle with anxiety disorders is hard to identify. A number of different causes are likely to work together to understand why the anxiety disorders are so common. Genetics, knowledge, and understanding, unpleasant or upsetting experience, and life's essential insecurity are all through to play a role in anxiety disorders growth. One explanation that anxiety disorders are so prevalent may though have to do with the fact that fear is such a common everyday occurrence. Are you aware that many of anxiety disorders are indeed more extreme versions of a common experience? This is real. Take for example the panic disorder. Panic disorder is a condition of anxiety in which a person experiences frequent attacks of blue panic. Some individuals with panic disorder feel that they are dying, or maybe at risk of dying during a panic attack. And as a result, they might try to avoid circumstances or behaviors that might cause a panic attack such as exercise. The previously mentioned broad survey found that at some point in their life, about 5% of people in the United States have had panic disorder. What this report doesn't tell us, however, is that the panic attack experience is very common. About 11% of people have had a panic attack in the last year, and 28% of people say they have had a panic attack in their life at some point. And this is not the case of panic attacks alone. Many more severe anxiety disorder as signs are also common experience among the general population. We learn about anxiety disorder is you first need to understand what anxiety is. We are going to take you through the fundamental of anxiety, including the anxiety symptoms and how the usual daily anxiety condition can turn into an anxiety disorder. We will also explain several common mental health disorders and unhealthy behaviors that often go along with anxiety disorders. Today's of this lesson, the goal of this lesson is to help you improve your anxiety comprehension and sensitivity so that we can better target it with the skills we discuss later. Okay, let's start. What is anxiety? When people talked about anxiety, the anxiety and fear feelings are often lumped together. Actually, they make sense in some ways because those two feelings sound identical in the body and have similar functions. All anxiety and fear are part of a natural hardwired alarm system of the human body, or the answer of a fight, including in fight. But in reality, there are different emotions. On the heading into the world, let's explore in more depth how anxiety and fear vary. Fear versus anxiety. Fear is more of an emotional experience of the present moment. Fear is what you feel when you genuinely find yourself in a situation of tension or danger. For starters, you will experience fear if you see a huge, scary dog running at you. On the other hand, fear is more a future-oriented feeling. If you are walking through a neighborhood where a huge, frightening dog once attacked you, You are definitely going to experience fear because you might be concerned about that mean dog emerging again. Your body is altering you for some potential dangerous situation in the future. Several scholars have suggested that fear could be labeled and anxious anticipation instead. Another way of thinking about the difference between anxiety and fear is to talk about what is like a ride roller coaster. Anxiety is what you are thinking when you hold to your seat and make your way to the white giant slope. When you ascend the hill, get closer to your final goal. You feel the rise peaking when you hit the top of the hill and feeling the slight pulse right before you go down. Fear is what you feel when you rush down the slope. Another feeling is about the excitement of an occurrence, and the other is about that even actual experience. Now, both fear and anxiety have a very important purpose. They warn you that you may be in a dangerous situation. That is a nice piece of information. Anxiety has yet another role as well. In fact, fear will warn you something is important to you, or is important and meaningful to you. So think about it. You are definitely more stressed when you are about to interview for a position you really want than if you about to interview for a job couldn't care less about. This is because you care about the job. It's another scenario. As they propose marriage to romantic interest, often people are nervous. This is not because the situation is risky. It's just because there is a huge amount of sense in the situation. It does matter. Now that we have defined the difference between anxiety and fear, let's reconsider the intent of an approach to the fight or flight response. The approach to fight or fight has been around as long as people have been around, because as we said before, it's the hardware alarm system in the body. When you think about human body as a machine, it is an essential part of the opening system to respond to the struggle. Without it, you couldn't actually function. The alarm system goes off when you meet a risky or threatening situation, and your body is going through a variety of modifications. For example, you can experience the following symptoms during the pre-fight response: an increase in heart rate, perspiration or sweating, narrowing of a field of vision, also called tunnel vision, muscle tension, sensitive hearing, racing thoughts, shortness of breath, goosebumps, dry mouth. These are not spontaneous experiences. They all have a very important purpose. They are getting you ready for immediate action. They train you either to read the situation and avoid any harm, or to fight if it's not possible to escape. In case where it is not necessary, a good idea to run or fight, the body may also freeze. The reaction is natural. It does happen without thought. This is important because when you are in a dangerous situation, it allows you to respond quickly. Let's imagine you're walking through the forest. You come across a bear. Your reaction to fight or flight will be turned on, and you will either freeze or run. The rapid and unconscious changes your body is going through help you keep alive in this dangerous situation. Now, if you had to think about the situation before the answer to fight or flight was triggered, you'll be wasting precious time. You need to measure the bear's height and the sharpness of its claws and teeth. So you'd actually be dinner for the bear by the time you found all of that out. The better solution is therefore incredibly helpful and versatile. Without it, we probably wouldn't be alive as a species today. If you are about to give a presentation to a large crowd and you are judging yourself as inadequate or incompetent, or you think the crowd may be aggressive and unforgiving, you're more likely to experience discomfort as you think the situation is threatening. Whether or not your evaluations are correct does not really matter. The body responds the same way, with terror, discomfort, and ultimately avoidance. When do you experience anxiety? When do you experience anxiety? You need to increase your awareness about when anxiety starts to happen to you through something called self-monitoring. You can do this. We want to. As the name implied, to track your everyday experiences. This exercise will give you some really important information. Thoughts and feelings aren't occurring spontaneously. In fact, the inner perceptions follow a set pattern, kind of like a routine. So, by tracking your daily interactions, you can begin to understand the types of situations that generally cause anxiety and the periods of the day when you may be more vulnerable to anxiety. If you notice that you tend to experience more intense anxiety in the morning by self-monitoring, you can use this information to make sure that during that moment you show up your defense. You may plan morning time to practice those strategies that we'll explore, or you may schedule your morning to make sure you don't have too much around the time on your desk. So, self-monitoring is important. So, you check up. First, describe where you were when the fear happened. Describe where you were when the fear happened. Are you at work, out with friends, driving your car, or just at home? First, measure the anxiety level on a scale from 0 to 10, 0 to 100, with 0 being either normal or very low, and 100 being the most nervous you've never been. Finally, rate your urge to avoid the anxiety or escape the situation in which you were, using a scale from 0 to 100, and indicate whether or not your turn. So, date, time, situation, intense of anxiety, 0 to 10, 0 to 100. Urge to avoid, 0 to 100. Did you avoid? Yes or no? Have this monitoring from with you all day long and feel it out whenever you feel anxiety coming on. Feeling it out as soon as possible will provide the best information after you have felt fear, because the memory will be fresh in your mind. It is also important to remember, of course, that tracking your fear can be an anxiety-provoking experience on its own. We are challenging you to concentrate on something you may not always want to listen to. And the simple act of bringing attention to something negative or awkward will make it feel a little more serious. Okay. Anxiety. First, anxiety disorders. We've been concerning on fear in general up to this point, and by now it is undoubtedly fairly clear that fear is not inherently problematic. It serves an important purpose, and for day-to-day life is indispensable. So, when do these feelings become a concern? If we all have fear and anxiety, then, in other words, when does anxiety and fear become a normal experience, become a disorder? In a nutshell, anxiety becomes an anxiety disorder when an anxiety you feel in a given situation is stronger than you might anticipate, and when it begins messing with some aspect of your life. For example, if your anxiety keeps you from establishing meaningful relationships with people or fulfilling your job or school commitment, this may be an indication that regular anxiety has changed to the anxiety disorder. Additionally, if you feel that in an attempt to avoid or minimize your fear, such as smoking or using drugs, you indulge in unhealthy behaviors, there is good chance that you will have an anxiety problem. Here are a few things you might want to ask yourself to see if you could have an anxiety problem. Anxiety disorders like specific phobia, social anxiety disorder, panic disorder, obsessive compulsive disorder, generalized anxiety disorder, post-traumatic stress disorder, anxiety and avoidance. The first anxiety disorder, we are going to addressing the specific phobia. In this condition, as individuals come into contact with certain items or circumstances, they feel such intense fear that they take steps to avoid certain objects or scenarios. Fear of heights, acrophobia, fear of dentists, odontophobia, fear of spiders, arachnophobia, fear of snakes, ophidiophobia, and fear of enclosed space, claustrophobia, a typical particular phobia. Social anxiety disorder is, the social phobia. It's another anxiety disorder in which a person experiences extreme fear and anxiety in social situations due to fear of adverse judgment. However, like with common phobia, this intense fear also leads to the avoidance of such social situations. Where public speaking is the most common type of situation people dread with social anxiety disorder. However, there are other scenarios people with social anxiety disorder may also avoid, such as eating in front of people, urinating in public toilets, or writing in front of people. The panic disorder. A person with a panic disorder surges regularly. Out of the blue panic attacks, as well as thinking about the nature or result of those panic attacks. Individuals with a panic disorder can assume, for example, that a panic attack is an indication that they are dying or going crazy. Because of these panic attacks, individuals with panic disorders frequently try to avoid behaviors or conditions that could induce anxiety signs, such as exercising or consuming heavy meal. Well, extreme case, people with a panic disorder may be afraid to leave home, as that is the only place they feel safe. If this occurs, a person may be diagnosed with agoraphobic panic disorder. Agoraphonic disorder. Next, obsessive compulsive disorder. We called OCD. Disorder has lately received a fair amount of media attention. A person experiences extreme, disruptive, and repeated disturbed thoughts and ideas that may be considered unusual and are not about real life issues. Such particular thoughts and ideas are considered obsessions. People with this disorder, for example, may have constant concerns that they will inadvertently kill their kids, catch a disease, or hurt someone else. As a result of these obsessions, individuals with OCD often engage in repetitive behaviors to decrease the anxiety associated with those obsessions, such as constant hand washing, scheduling, testing, or conducting behavior tasks, such as counting. Generalized anxiety disorder. Generalized anxiety disorder is characterized by severe, chronic, and uncontrolled preoccupation with many different concerns. Many often equate GAD with OCD because they both include the perception of a repeated thought. Concern, though, is different from paranoia, as GAD's concern is about real life or everyday issue, such as investment, jobs, and connections. Worry in GAD is simply seen as an attempt to avoid or divert a person from thoughts and feelings that are more vulnerable to disturbing and anxiety. Post-traumatic stress disorder. Finally, post-traumatic stress disorder is particular to anxiety disorder, as it is the only one that allows people to experience some kind of a traumatic event before they can be treated. PTSD is diagnosed if a person has a set of symptoms more than 30 days after being subject to traumatic event. The PTSD signs include repetitive thoughts and memories about the traumatic event. For example, hallucinations or thinking as if the experience was unfolding all over again. Suppressing reminders of a traumatic event, experiencing difficulties, expressing positive emotions, becoming distant from others, any hyperarousal and hypervigilance. If somebody developed this effect after a traumatic event within a month, we term the condition and acute stress disorder. Anxiety and avoidance. Now, alongside the feelings of anxiety, which obviously goes without saying, the urge or desire to avoid the dreaded event, encounter, or circumstance is one activity that is prevalent among all anxiety disorders. However, just as it makes sense to learn to avoid unwanted or uncomfortable situations, it is a natural response. Avoidance is actually the primary reason anxiety disorders have a detrimental impact on a person's life. Anxiety and avoidance, it explicitly work together to form a vicious circle which effectively traps an individual. Let's just think about how this happened. We talked earlier about how people who struggle with anxiety are more likely to notice or focus their attention on the very things that they fear in their internal, inside the body, or external, outside the body settings. And when you think about it, it's something that can potentially be defensive. For starters, if you are scared of a dangerous object in your setting, it's definitely in your best interest to make sure you keep the eye out of the object so that when you see it, you can act as quickly as possible. Sadly, this method has its drawbacks too. That's because the more we pay attention to or raise our knowledge of the unknown artifacts we may meet, the more likely we will find them and be influenced by them. For starters, you are more likely to notice natural change in its rhythm if you pay attention to your pulse. This will cause a significant fear for someone with an anxiety disorder, such as panic disorder. Now, if you focus your attention on an object or feeling that is dreaded, what happens next? Well, most people have trouble redirecting their attention away from the object or feeling that they hate. So most people will then task steps to try and get away from anything that makes them nervous. For instance, if anything you're scared of is in your external environment, you could avoid the position. But if what you are scared of is an inward emotion, such as thought or physical reaction, you may want to do something to get rid of fear and bring down your anticipation. This is how chronic anxiety disorders will wreak havoc. It's really common for people with anxiety disorder to get caught up in a vicious cycle in which they draw their attention to dread stimuli and experiences immediately, have trouble redirecting their attention away from them, and then try to avoid them. While it may seem like a lot of sense to try to avoid things, then you are nervous. The concern is that isn't actually possible. As you probably know, all anxiety-provoking scenarios, particularly those happening inside the body, can't be avoided. As a consequence, in their attempt to feel safe or alleviate their fear, people with anxiety problems frequently develop severe withdrawal habits, such as drinking heavily or never leaving home. The issue that comes up when people get caught in this loop is that the more you ignore something, the more you know that there is to fear about what you're avoiding. Why else would you avoid it? And resisting things that we hate will actually cause us to fear them even more. Another concern is that denial really just operates in the short term. Avoidance can in fact make fear worse in the long term. This behavior perpetuates the cycle of fear and depression, making it stronger and deeper before life is anxiety free. Not unexpectedly, with anxiety disorders, we often see a variety of other mental health issues arise. We will end the first lesson with a quick review of various disorders that often go along with anxiety disorders. Okay. Substance use disorders. People with anxiety disorder often struggle with some form of substance use, such as excessive smoking, alcohol consumption, or drug use. Those with a social anxiety disorder, for example, have been shown to be at high risk for alcohol abuse, and those with PTSD often have drug abuse issues. So, why do people with anxiety disorders still find themselves dealing with drug use? A number of theories exist, but the most common theory is called hypothesis of self-medication. The theory says people struggling with anxiety and experience anxiety disorders can use controlled substance as a means of reducing their anxiety. Essentially, the use of a controlled substance is, according to this definition, a way of avoiding or enjoying fear. An example, as people continue to rely on controlled substance to relieve their anxiety, in addition to have an addiction to the medications they are using, they may also become more and more nervous. And although this may have in the short term, it generally fires back in the long run, leading to addiction to the drug and all the problems associated with it, in addition to even more anxiety than they feel to start with. Depression. Disorders of depression and anxiety go hand in hand. In fact, studies have found that well over half of the people in their lifetime who have had an anxiety disorder also had a major depression. For fact, depression is likely to go along the PTSD, GAD, and OCD. What could explain that? Between anxiety disorders and major depression, there is a lot of overlap. All depression and anxiety disorders, for example, have a history of intense negative feelings. Many of the same risk factors that can contribute to anxiety disorders have also been shown to lead to depression. And people who experience these kind of risk factors may be more likely to develop both depression and anxiety disorders. Eventually, the way the signs of anxiety disorders may lead to depression is easy to see. For starters, feeling stuck to the house of fear of having a panic attack if you go outside would possibly have a life significant to you in the way you live. People with the anxiety issue often spend so much time trying to escape the problem they dread without having a time or a resource to do things that matter to them. So, as it has been said, sometimes the things that matter to people are the very things that cause anxiety and fear. If they ignore the things they hate, people may end up trying to avoid all the things that matter to them in their lives. And seeing how this could relate to depression is fairly easy. You know, the eating disorder. Eating disorders and also quite frequently in anxiously disorders individuals. Studies have found that 12% of people with anxiety disorder have an eating disorder. And there is proof that the history of anxiety disorder related to the eating disorder emerging. Eating disorders usually take the form of either anorexia nervosa, the restricting the intake of food to such a degree that the person is severely underweight, or bulimia nervosa, a period of binging and purging in which large amount of food ingested and then removed by some combination of the rather of exercising or misuse of laxatives. Just like substance-related issue and depression, there's very valid reason why so many people with anxiety disorder may be dealing with eating disorder. Essentially, the unhealthy eating habits seen in eating disorder diagnosis can be used to relieve or reduce anxiety symptoms, just like drug uses. Studies have found, for example, that disordered eating behaviors like binging and purging can be used to help with emotional distress and to alleviate negative emotions. Think about it. Feeding is one of the most important ways for people to soothe themselves. And even those who do not have anxiety disorder often use food in times of stress to provide relief. Therefore, it makes sense for people who are struggling with intense anxiety to turn to the comfort food. So, considering that many people with anxiety disorders feel as though their lives are beyond their grasp and have trouble with confusion on productivity. Another reason of eating disorders such as anorexia nervosa is common among people with anxiety disorders. Maybe that this condition may offer people a sense of power. Sadly, the sense of control is an illusion because eating disorders will actually take on their own lives and get out of control. However, in the short term, restricting food intake deliberately and deciding not to eat will give people a sense of control of at least some aspect of their lives. Therefore, diet destruction may be one way to try to establish a sense of balance for people with anxiety disorders who feel as if their lives are out of control. Borderline personality disorder, BPD, is the last. BPD is a disorder characterized by the feeling, thought, interactions, personality, and behavior dysfunction. Those with BPD experience trouble controlling impulsive or self-destructive actions and often have a dysfunctional and disturbing interpersonal relation. Often they still live for their personalities, not knowing exactly who they are or how they are. Furthermore, individuals with BPD are dealing with their feelings and often perceive their emotion as powerful, uncontrollable, overwhelming, and intimidating. Anxiety is one of the feelings people with BPD suffer the most. In addition, more than 80% people with BPD also have an anxiety disorder. With social anxiety disorder, panic disorder, and PTSD being the most common one. So, why go hand in hand with the BPD and the anxiety disorders? Okay, one explanation is that some of the same events actually because BPD in some of anxiety disorders. Childhood abuse, for example, is one of the main causes of both PTSD and BPD. Additionally, some of the same personality traits that were thought to cause anxiety disorders were also found to increase BPD risk. Of example, one personality trait strongly associated with anxiety disorder is vulnerability to anxiety, or the propensity to avoid the symptoms of anxiety due to assumptions that those symptoms will have negative consequences. Okay. So far, we learned about anxiety and anxiety disorder. Next week, we're gonna learn to understand the anger. See you next week.